Imagine that you are a psychologist who treats patients. One day, Leslie comes into your office. Leslie feels blue, feels tired all the time, and isn't interested in hanging out with her friends or other things she usually enjoys. As Leslie's doctor, how do you go about treating her? Well, you could treat each symptom one by one, but wouldn't it make sense if you could figure out how to treat them all? In the 19th century, Emil Kraepelin noticed that the way psychologists approached mental illness was neither efficient nor particularly good for the patients. He introduced the idea of classification, that is, grouping psychological disorders by common patterns of symptoms. The idea behind classification is that there is not one symptom that appears only in one psychological disorder. For example, there's not a single symptom that is found in obsessive-compulsive disorder that's never found in another anxiety disorder. Instead, it is the unique pattern of symptoms that distinguishes obsessive-compulsive disorder from other anxiety disorders. Since Kraepelin, classification has evolved. Today, the most commonly used classification system in the United States is found in the Diagnostic and Statistical Manual for Mental Disorder, or the DSM, which is put out by the American Psychiatric Association. Classification of psychological disorders is obviously very useful, but there are several major problems with classification. One problem is that of reliability, or the idea that the classification system should give the same results every time you use it. For example, if I'm using the DSM to diagnose Leslie today, and I come up with a diagnosis of a major depressive episode, then tomorrow the DSM should result in the same diagnosis for Leslie. There are two types of reliability: inter-rater reliability and test-retest reliability. Inter-rater reliability is the idea that two people using the same classification system will come up with the same answer. For example, let's say that you and I both see Leslie. If we are both using the DSM to help us diagnose her, and we observe the same symptoms, then we should both come up with the same diagnosis. Compare that to test-retest reliability, which is the idea that one person using the same classification system on another person should come up with the same diagnosis each time. For example, if I see Leslie and I use the DSM to diagnose her as having bipolar disorder, then if Leslie comes back tomorrow or next week with the same symptoms, I should also come up with bipolar disorder as the diagnosis. So how is this a problem? Classification of mental illnesses have had some issues with reliability. Inter-rater reliability from one doctor to the next isn't always high because disorders overlap. For example, you and I might both agree that a patient has an anxiety disorder, but we may disagree on which anxiety disorder that patient has. Likewise, sometimes test-retest reliability can be low, though generally inter-rater reliability is a bigger issue. The DSM is in its 4th edition, and each revision tries to increase reliability. That is, its authors continue to try to make diagnoses the same between people and over time. Another issue with classification involves validity, or whether or not the system identifies real disorders. You might be wondering how a classification system could not identify real disorders. Think about it like this. What if Leslie's symptoms are not usually seen together? Does she have a disorder that is not in the classification system? Is she just a very unique person who maybe has several disorders? Answering these questions is not easy, and the answer can affect the validity of the classification system. There's another question about validity in classification, and that is whether or not there are actual disorders that exist out in the real world. Some people argue that the act of classifying disorders creates false disorders. Instead, they say, mental illness is a social construct, and that psychological disorders are not real in the same way that, say, diabetes is real. The debate over whether mental disorders are real or not continues, as does the effort to create validity within a classification system. Classification of mental illnesses involves grouping symptoms together to form a diagnosis of a psychological disorder. The father of modern psychological classification is Emil Kraepelin, whose 19th century classification system became the basis for the system most psychologists use today, the DSM. Two issues with classification are reliability, or how consistent diagnoses are, and validity, or whether or not the syndromes in the system are real.